Without any further, please welcome Dr. Marhas Linda.
Okay, Assalamualaikum dan selamat siang semuanya. Ya, can you hear me clearly? Boleh dengar jelas nggak?
Yeah.
Boleh dengar jelas? Okay, saya
jelas dokter.
angguk kepala. Alright. Jelas, alright. Alright. First of all, thank you, Dr. Alia, for the kind introduction. Yeah. Also, special thanks to Dr. Gia. Yeah. Yang berkomunikasi dengan saya banyak kali. Ya. Terima kasih. Ya. And I also would like to extend my gratitude to Prof. Taufan for inviting me to give this lecture. This is the first lecture of 3 series of lectures. Yeah. Now,
thank you, Dr.
Hey, hi, you are here. All right, thank you, Prof. Taufan. Okay.
Thank you.
Sebab
welcome to you.
Saya mula ya, Prof. Taufan.
Ya, sila.
Okay, all right. Okay. So our lecture today is on how to do a critical appraisal of a research paper. Yeah. Sebab kita tidak punya banyak masa, I will just straight focus to what is the topic all about. Now, hopefully, by the end of this lecture, so for all the students, we should have in mind, by the end of this lecture, hopefully, insyaAllah, we should be able to, number 1, understand kenapa importantnya critical reading of scientific article. Yeah. Number 2, at least we understand or know the standard appraisal question when you read a paper. Yeah, addressing to each section of a paper. And finally, hopefully, at least you have some idea how to do a proper critical appraisal of a scientific literature. Yeah, so that 3 of our objectives. Now, what is smart reading all about? Bila kita ambil paper, when we have a scientific paper in front of us, you must first be clear, what are the reason for your reading? Kenapa kita baca paper tu? Adakah for leisure saja? Some people, they love to read, so they read scientific paper just for leisure. So you read for leisure, then a different mindset of reading. Or you are reading for looking for evidence. Yeah, you are a doctor or a dentist. Yeah, later in future, and you want to do something for your patient, you need to look for evidence. So you have to be clear first, what are the reasons for your reading? And next, you must specify what information do you actually need. Mungkin in your mind now, you sebenarnya nak tahu a burden of disease. What is the prevalence of COVID-19 in Jakarta? So that is about prevalence of disease. Okay? Or you would like to know, is this vaccine, a new vaccine, for example, is effective to cure COVID-19? Then that's a different information that you need. Because why we need to specify your information need? Because different information will actually lead you to different report. Kalau kita mahu tahu tentang burden of disease, prevalence of certain disease, then you may want to find reports on prevalence study. Yeah. If you want to know about effectiveness of certain medication, then you may want to look at intervention study, yeah, which has different database, different reports. Okay, now let's say you are clear what's the reason, what's the information that you need, and you have the papers in front of you, and now you need to read the paper. And when you read, you need to critically appraise the paper. Now, come to the question. Why is it important for us to critically appraise a paper? Number 1, okay, before that, am I too fast? Am I too fast in talking, or are you okay following me? Dengar ke?
It's okay, dokter.
Okay, tidak cepat sangat ya? Okay,
Ya,
alright.
tidak.
Now,
Makasih.
okay, why is it important to critically appraise? Because there's a lot of evidence. Ada sangat banyak scientific evidence ni. Ada sangat banyak database ya, and not all studies was conducted properly. Yeah, not all study is of good quality. Jadi we have to read a paper secara critical. Critical appraisal ni maksudnya you read a paper systematically, secara systematic, to identify what are the strengths, what are the weakness, does it address the objective appropriately, adakah metodologinya solid, ya, supaya we will be able to identify whether the study finding is actually useful and valid. Kalau dia useful and valid and of good quality, itulah baru you can apply to your patients or you can make a new policy. So before kita apply something new to our patient, either treatment or you're making a new policy, especially in public health area, we need to have a good quality paper as our reference, right? So that is why it is important to have a skill to critically appraise a scientific paper. But bear in mind, untuk kita critically appraise a paper bukan senang. I mean, like, okay, let's say now you are listening to my lecture. Maybe some of you are very good already in appraising a paper, but maybe some of you, especially students kan, yang belum banyak experience, you may find it a little bit difficult to follow, but it's okay. Sebab critical appraisal ni is a skill that you have to master gradually. And sebelum you boleh critically appraise a paper, you definitely need to have a solid research methodology knowledge. So to have a solid research methodology knowledge, kita memang kena develop lah knowledge tu. It will develop with time, yeah. So sometimes mungkin masa first, second time, third time, even 10 time when you read a paper, you find it difficult to critically appraise. That's okay. You slowly develop your research method skill and you will find yourself getting better at appraising a paper. Yeah. Okay, now, papers can be read by asking a series of questions addressed to various sections. Kita punya scientific paper tu, dia ada various section. We have introduction, we have method, we have a data collection or conduct of the study, we have result section, and we also have the discussion section. So actually, for each section ni, we have a different series of questions that can be asked for us to see whether it's of good quality paper or not. Yeah. Now, this is just a general question. Let's say you have a paper in front of you. Yeah. The first question, kita ada banyak paper ni, mungkin ada 50 papers, yeah, on a certain topic, a very wide topic. So you need to ask first, is this paper of interest? So how do you know whether the paper is of interest? Where to look to? You have to look at the title and the abstract. Skim the title and skim the abstract. Because not just title, you have to skim title together with the abstract. Because this is the immediate guide whether this paper in front of you is worth reading or not. Kalau title-nya bagus, but when you read the abstract, it's not what you want and it doesn't have any added value to what you already know, so maybe it's not worth reading. Yeah, whether the topic is relevant, not. Sometimes the study is conducted very good, but it of little less value because it is not relevant anymore. The topic, for example, mercury in amalgam is already an outdated topic, so it's not relevant. Yeah. This title and abstract actually is a preliminary indication of how well the study was conducted. So from that, okay, title, abstract, good. So you move to the next one. So why was this study done? Where to look this information? You have to go into the introduction. So in the introduction of a paper, the paper should talk about the background of the study and what are the gaps. There must be gaps or problem statement. A study without gap or problem statement is not a good study because they didn't know what is the problem to settle to achieve by conducting a study. For example, let's say we would like to see whether anthropometric measurement, our body measurement, has any association with dental caries or not. Adakah kalau kita gemuk, kita akan dapat lagi banyak gigi berlubang ataupun tak ada kena-mengena. So what we already have now, we have many studies conducting on this, looking into association between anthropometric measurement and dental caries. So what is the gap? So when you read this paper, they mention the gap is all this while all the study has looked into how BMI associate with dental caries. That's not my study looking into how with circumferential, how with hip ratio, how our skin for the bicep, and these are all anthropometric measurement, whether it associate with dental caries or not. So that is the gap. So that is why they are now going to study whether with circumferential associate with dental caries. So the gap is clear. Then you know they are clear with what they're doing. So in introduction, must have clear purpose. How do you know this study has clear purpose? You have to find the research question or hypothesis and study objective. You'll be surprised when you read more paper. There are papers without research question or without clear objective. There are many. Yeah. When you read many times, you do not know what are the study objective. So then you know if there is no clear study objective or not even have research question, meaning the author or the paper has no clear idea what are they doing. Maybe they are forced to publish a paper or they just publish a paper and the research is just conducted very poorly. So you know from that, you don't have to read more. Yeah, because the research question or objective is not clear. Save your time. Yeah. Now, third one, how was it done? How is this study was conducted? This is where you look into the method. Method is very important when you do critical appraisal. Provided that they have research question, hypothesis, objective clearly, when you do go into method, you have to read it properly because method lah yang akan indicate the quality of the study. Whether you want to know this is a poor study or good study, you have to look into the method. In the method, it should be sufficient details and information to indicate what is the study design. There are papers without study design, then you stop. Yeah, who was studied? Who are the population studied? They have to explain in the method how is this sample recruited in the study? How many? Yeah, how do they measure? Yeah, what analysis was conducted? So it should be in the method. Yeah. Now, I will explain this in detail later. So if you are your intention of reading a paper, you want to look at the method of conducting study. How is the other study doing the same topic in other population? Then you go into methods. Now, if you want to see what has it found, of course, you have to look into the result. Now, when we read the result, it's not just reading the result, look at the table, yeah, blindly. You have to know, when you look at the result, first thing in your mind, you have to have the objective of the study. And you have to compare the result, whether the result, you reported, achieve the study objective. Okay. This is one more thing where there are also many studies. You found that when you read this objective, when you look at the result, this result is talking about something else, yeah? Because it is of their interest, maybe in a significant finding. So they just report the result, but it didn't answer the objective. So in the result chapter, result section, you must look at the result. Oh, okay, result ni tengok, compare dengan objektifnya. Okay, this table actually is tackling this objective. Oh, this explanation is answering this objective. That is how you look at the result of a scientific paper. And the result needs to be presented in a logical sequence. Logical means in the result, first part, of course, they need to explain descriptive, demographic, siapa population yang di study, ya, berapa perempuan, berapa demographic lah, berapa lelaki, umurnya berapa, kenapa kita kena ada ini? Because you would like to know whether this study conducted on your population of interest. If there is a new drug, yeah, this study is actually looking at the effect of new drugs on an older population. But your interest is on the younger population. So you have to read it in caution because this is effective among orang tua. Tapi yang saya punya patient ni orang yang lebih muda. Jadi that is why in the result section, the paper should actually explain demographic factor. Yeah, result yang tak ada demographic factor, you have to read in caution. Yeah, you must highlight the key finding. Bukan semuanya mesti diletak di dalam result. Yeah, and when you read the text, dia akan lead you. Dia very organized, ada flow. That's a good paper. Yeah, Kalau the result is haphazard, memang sometimes when we think, we feel that how come it is published if it is haphazard, kan? Memang kita akan tanya begitu. But kita ada macam-macam journal, journal pun ada ranking, even a good journal also sometimes publish a poor paper because it's also depending on who are the reviewers, ada reviewers yang tidak strict, so you still have to look at the paper individually. Memang ada paper yang haphazard. When it is haphazard, you can see the result is actually sequence, tak ada sequence, so it reflects the understanding of the writer, or maybe the result have not been fully analyzed. Okay. Next one, you would like to know what are the implication. Okay, ini study yang dibuat, apa kesannya? Apa implikasinya? So you have to go to abstract and discussion. This is where you know the value of a study, whether this study can be generalized or not to your population. Ini study dibikin among Caucasian population. Adakah sesuai untuk Indonesian population? Maybe sesuai kalau topik itu tidak involve culture, tidak involve contohnya diet. Kalau diet mestilah lain. Jadi whether it can be generalized or not, you have to think about that. So is there any new thing that relevant to your patient or your policy? So what does the finding of that paper mean for your healthcare? Kalau yang lain-lain tu you boleh jumpa dalam intro discussion, maybe useful reference apa problem yang mereka lalu bila nak buat study tu. So you know that that is the problem. So when you want to conduct a study, you can take that as your guideline so that you can you anticipate what is the problem. Okay. So far so good, Boleh faham? Boleh faham so far?
Ya dokter, paham dokter.
Online ni memang susah, tak boleh kalau face to face kita boleh dengar, faham, tidak faham. Online ni, okay, Aulia tolong jawablah, terima kasih.
Yeah.
Now, okay, when we critically appraise a paper, actually there are standard appraisal question. Ada banyak soalan, tapi ini yang standard lah. Untuk permulaan ini, maybe we talk about standard appraisal question dahulu. Kalau ada sesiapa yang tidak faham atau rasa saya laju ke apa, you can just tell me, stop me, ask me, tak apa. Now, imagine you have a paper in front of you, an article, scientific paper in front of you. Now we are doing a critical appraisal. Tadi you sudah faham apa yang kita nak tengok di setiap section. Now we are going to appraise. First thing, tadi kita sudah cakap kan, you must look at the paper, the aims are clearly stated. Okay, aim and objective should be clearly stated. Okay, sometimes they don't have aim, but they have research question. Pun tak apa. Tapi the research question or hypothesis should be clearly stated because it indicates why the study was carried out, and it will tell you whether this research tackle an important problem or not from the aim and objective or research question. It will tell us whether this paper that I'm going to read, is it going to add any new information to whatever I already know? Now, a clearly stated and focused aim, dia menunjukkan hypothesis tu mereka sudah ada in advance. Meaning when they conduct a study, sebelum dia buat study tu, they already have their hypothesis. Their hypothesis is, I think this method of teaching, online teaching, is better than face-to-face. So mereka pun buat study. So they already have the hypothesis. Kalau tak ada objektif tu, memang dia tak ada lah hypothesis tu. Why is this important? When the aims are clearly stated, it indicates that this is a well-planned study. A well-planned study with objective, and they will collect a useful data. Only when you have organized objective, you will collect useful data to answer the objective. If you don't have, if the paper tak ada clearly stated aim, mungkin some of you lah may have experience where you go to the field and do a survey. Let's collect whatever we can. Banyak yang macam tu kan, let's just collect lah. Nanti later kita tengok, analyze. That means you don't have a proper objective. Sometimes you will waste time, waste money to collect unnecessary data. Okay, so that's about when you appraise some paper, you need to see whether the aims are clearly stated. Number one. Number two, this is very, very important. Sebab this is, when you read a paper, you have to see whether the design, the study design is appropriate or not. Yeah, is the study design used is appropriate to address the stated aim. Tadi sudah ada objective yang very clear. Now you have to look at the study design, because different study design address different objective. I will give example after this. Kalau studinya, objektifnya tadi sudah jelas ya. So objektifnya to look into prevalence of a disease ataupun what are the possible associated factors of the disease. Disease-nya COVID-19. Apakah faktor yang mempengaruhi atau berhubung dengan untuk mendapat COVID-19? What are the factors? Jadi itu boleh hanya cross-sectional, ya, associated factor. Kalau we would like to know the causal, what risk factor or exposure that cause this disease, then the study design need to be cohort or case control. You cannot use cross-sectional. Jadi when you read the paper, the objectivenya untuk tengok risk factor. Tapi when it comes to study design, they use a cross-sectional. Then you know it's not a good study already because they use study design yang tidak betul, yang inappropriate, that they will never achieve the objective. Walaupun objektifnya clear. So ini sangat penting. Study design must be appropriate. Kalau untuk melihat treatment efficacy, of course intervention ya, study. Saya bagi contoh ini study design. You have clear objective of the study, must have appropriate study design to achieve objective. So apa study design-nya? So that you need to look into that paper. You kena cari. Contoh jelas sudah objektifnya. To determine prevalence of malocclusion class 2 among children with thumb sucking habit. Kanak-kanaknya ada habit suka hisap jari ya. So we would like to know prevalence kejadian ada malocclusion class 2 di kalangan kanak-kanak yang menghisap jari. So you do a cross-sectional study where we gather 100 children with thumb sucking habit and you examine how many has actually class 2. And then you found 65 out of 100 has class 2. Meaning the prevalence, so the paper conclude the prevalence of malocclusion class 2 is like 65%. And that is correct because they are using a correct study design to address the objective. Okay. Now what happened is the same thing, same subject, but now the objective is to investigate if thumb sucking is a risk factor for malocclusion class 2. Now, sorry, excuse me. To investigate if thumb sucking is a risk factor for malocclusion class 2. Yeah. This is whether thumb sucking cause the malocclusion class 2. So again, we gather 100 children with thumb sucking habit. And then we found 65% having class 2. So we conclude, yeah, thumb sucking is actually a risk factor. Yeah, it's a causal factor to get a malocclusion class 2. Is that correct? What if you also gather 100 children without thumb sucking? Then you examine and you also find 65% also ada juga malocclusion class 2. Yeah? Then you conclude, oh, actually thumb sucking is not a risk factor. So your first conclusion is wrong. The second conclusion is right. But you have to look at the objective now. Objektifnya berbeza dari yang tadi. Yang tadi determine prevalence saja. Tapi yang ini, dia nak tengok thumb sucking tu risk factor ke tidak. Bila risk factor, desainnya sudah lain. Ya? You have to have a group with a risk factor, a group without a risk factor. Baru boleh buat conclusion. It will only become a risk factor, thumb sucking is a risk factor, kalau prevalence-nya lebih di kalangan kanak-kanak yang thumb sucking compared to yang tidak thumb sucking. Katakan di sini hanya 20% saja class 2 yang without the thumb sucking habit, the children only 20% class 2. Then only can you conclude thumb sucking is a risk factor because more class 2 among the children with thumb sucking habit. Jadi kita boleh lihat study design-nya ini apa. Ini bukan cross-sectional sudah. Bukan cross-sectional lagi. So for some objective, mesti ada comparative group. Ya, saya bagi contoh lain ya. Comparative group. Ini katakan the objective is to investigate whether bruxism, ya, kita itu ketap gigi, ya, is a risk factor for TMG pain. And the paper conduct a cross-sectional study. And when you read paper, okay, dia nak tengok investigate bruxism ni risk factor TMG ke tidak. Tapi dia buat cross-sectional study. Cross-sectional means they just do cross-sectional ni, snapshot, ambil 50 orang, ambil 100 orang ya, ada 40 orang TMG pin ataupun 50 orang ada TMG pin, 5 to make it simple, 50 orang tak ada TMG pin, and then you tanya dia, ada bruxism ke tak ada bruxism, and you found that among your sample with TMG pin, only a few have bruxism, tak ramai. And among patient without TMG pin, many have bruxism. So from this result, from this cross-sectional study, it looks like bruxism is like preventive or protective factor. Because when you have bruxism, sebab di kalangan without TMG pin ni banyak yang ada bruxism. So it's okay to have bruxism because it protect you from TMG pin. But it's not correct, right? We know that bruxism can lead to TMG pin. But this study has come to this conclusion because it has used a different study design to answer the objective. Again, the objective is to look at risk factor, but they use cross-sectional study. So sudah salah. So when you appraise the paper, when there is any objective looking at risk factor, if the study design is cross-sectional, you know already that this study bukan tidak appropriate to achieve the objective. So boleh tolak tepi lah paper tu. Yeah, it's not the right paper. Okay. Sepatutnya, what should you do to investigate whether bruxism is a risk factor? You should actually collect bruxism, katakan 50 patient, no bruxism 50 patient. So at the beginning, both group have no TMG pin, and you follow for how many years? And then you look at how many develop TMG pin among those with bruxism, and how many develop TMG pin among those without bruxism. Then you know whether bruxism really cause TMG pin or not. Only when more people develop TMG pin among bruxism, then you can say bruxism is a risk factor. This is what we call temporal relationship in cohort. Ya, sebabnya kalau objektif kita tu, kita nak tengok sama ada sesuatu perkara tu menyebabkan sesuatu penyakit, haruslah perkara itu datang dahulu, terjadi dahulu sebelum penyakit itu datang. Betul tak? Kalau lung disease, kita nak kata smoking cause lung disease. Mestilah dia smoking dulu yang buat. He has to smoke first, then follow, then whether the lung disease occur. So the study design need to have temporal relationship. Okay. Contoh lagi ya. Investigate. Kenapa saya banyak bagi contoh study design ni? Sebab ini perkara utama. Kalau kita miss yang ini, and the result look very convincing, but we miss this, when this is wrong, even convincing result also is wrong. Yeah? Now, to investigate whether cruciferous vegetable protect people from developing oral cancer. This is an oral cancer patient, cruciferous vegetable like cauliflower, yeah, broccoli, yeah, whether they protect people from having oral cancer or not. And again, you do a cross-sectional study. When you conduct a cross-sectional study, you gather people with oral cancer, people without oral cancer, and you ask whether how about their CV intake, berapa banyak dia makan cruciferous vegetable. And you found, the study found, study yang you sedang baca ni, found that high CV intake among oral cancer patient, less CV intake without oral cancer patient. And with this finding, the paper may conclude, oh, actually, taking more cruciferous vegetable can lead to oral cancer. Oh, maknanya, and then because you have no knowledge about research methodology, for example, then you, actually makan cauliflower semua ni tak bagus sebab dia a risk factor for oral cancer. Not knowing that this is a not valid finding. Because when you look at ni macam risk factor, protect people, maknanya bukan risk factor, dia tidak boleh cross-sectional again, ya. So, because maybe people with oral cancer ni, they increase their intake of CV. Lepas dia diagnose of oral cancer, baru dia makan banyak cruciferous vegetable, right? Because you do a cross-sectional study, you found that orang kanser ni lebih banyak makan. Sebenarnya, kalau kita nak buat association macam ni, we have to look at the past intake of cruciferous vegetable. Macam ni. If the objective is to investigate whether CV protect people from developing oral cancer, you have to start with oral cancer, without oral cancer, and look at the past exposure. Ya, daripada 10 tahun yang lepas, contohnya, but it's a subject to recall bias lah. Low CV intake, high CV intake. So the intake of cruciferous vegetable mestilah before disease develop. Again, this is called temporal relationship in case control study design. Okay, lagi sekali, I just would like to highlight ya. Kalau if you find this lecture senang nak faham, some of you maybe can relate to it very well because you already have some good knowledge of research methodology. But untuk student yang year 3 yang mungkin baru belajar ya, mungkin ada yang kalau rasa susah sikit nak faham, jangan risau. Nanti balik you record kan, you dengar balik slowly, you akan faham. Ya. Now, so if the objective of the paper is to investigate whether A is a risk factor of B, study design-nya mesti ada temporal relationship. Kalau no temporal relationship, when you say temporal relationship, maksudnya sama ada cohort, iaitu study tu ke depan, ataupun case control, study tu lihat ke belakang past exposure. Kena ada temporal relationship. Without that paper actually are giving you a faulty conclusion. It's a poor paper. Because cross-sectional study only can conclude as associated factor, not as a risk factor. I hope you all okay up to here. Okay, let's say the objective of the paper to compare various distraction techniques in reducing dental anxiety among children with during dental treatment. So the outcome here is to reduce dental anxiety. So ini ada group of children sangat anxious ya untuk dapat dental treatment or any medical treatment. So you actually would like to test different techniques to reduce the anxiety. So when you are trying to test the effect of something, when you're introducing something to change the outcome, in our case here, to change dental anxiety, you cannot use cross-sectional study, you cannot use case control or cohort study. So the paper the study that you are now reading, the phrasing, they have to use intervention study or intervention experimental study intervention sama saja ya. Like RCT, for example, this is anxious children. So you want to try no distraction technique at all. You may want to try puppet, or you want to use a mirror, or you want to use storytelling method. Then you want to see which method actually reduce dental anxiety more. Then this one, if you read a paper like this, where they are testing some method or introducing new drug, then if they use intervention study, good, you can proceed to read the paper. Now, okay, fine. So we finish. Aim must be clear. Study design must be appropriate to achieve the objective. Next one, look, when you read a paper, you have to find, did they actually look at the sample size? Was the sample size justified? Sample size ni penting ya untuk di estimate and should be described in method section. Because the study should have large enough sample size untuk detect difference. Sometimes, because too small a study, you will be able to detect effect. Katakan kita nak tengok ada beza tak tinggi, let's say a new treatment modality, treatment A and treatment B. You want to compare, So, katakan treatment ni untuk oral cancer lah, oral cancer ataupun whatever cancer that we have in the body. So, there's two treatments. And these two treatments, your outcome is percentage in mortality rate. Jadi, berapa beza in mortality rate yang we would like to see the difference between treatment A and treatment B, that is of important for you to detect. Maksudnya, treatment A ni, let's say, is an existing treatment. Kalau we treat a cancer patient with this treatment, mortality rate-nya 50%, a bit lower, 50%. Now we are introducing a new treatment with this new treatment, kalau treatment ni boleh reduce mortality rate to 30%, so difference of 20%, yang lama 50%, yang baru you would like to reduce 20%. So the new treatment should have mortality rates 30%. So you would like to detect a difference of 20%. When you calculate, dia ada dia punya software to calculate sample size, and when you want to detect a difference of 20% in mortality rate when they use treatment A and treatment B, it will give you what are the sample size. Dia akan beritahu, okay, sample size you need 200 patients. If there is different 20%, you will get significant result. But if you take patient 100 saja, sepatutnya 200, but you ambil 100. Even if you have difference 20% in mortality rate, your study will come out as non-significant. So maknanya, result keluar non-significant bukan sebab tiada different, but because your study is too small. So it won't be able to detect the effect. Jadi, sample size ni important in a paper. You have to search, did they explain on how they come to that sample size. Study with high quality will address sample size in discussion. Yeah? Now, next, you have to look this all in the method, who and how the subject were recruited. So, how to look at it? When you read a paper, you tengok siapa reference population here. Reference population meaning to whom they are going to generalize the result. Katakan smoking di kalangan remaja Indonesia, for example. So, you are conducting a new study, a mobile application lah. Yeah? You are introducing a new mobile application. Where with this mobile, ada macam-macam knowledge, motivating, macam-macam di sana. You would like to see whether this mobile application can actually change smoking habit among remaja Indonesia. So, your reference population, study ini adalah untuk, study yang dibuat ini adalah reference populationnya untuk digunakan kepada siapa? Digunakan kepada remaja Indonesia. However, the paper need to explain from where the subject were recruited. You cannot study all adolescent, Indonesian adolescent, right? So, there must be some way. Dari mana mereka ambil subjek ini? Maybe from school. Yeah? School. Okay, fine. Study ni ada cakap dari mana. Did the paper explain how they actually choose the subject? How they actually choose the docent from the school? Because we want to avoid selection bias. Adakah dia mention in the paper any inclusion exclusion criteria? Siapa yang dia include? A docent age 16, 18, or berapa? Siapa yang dia exclude? Kena ada criteria tu. Yeah? Then, what are the sampling method that they use? So when they choose, are they just taking from one school to represent the whole Indonesian docent? Adakah ini semua methodology punya knowledge? Whether they use random sampling, they take randomly, or they take conveniently? Adakah mereka matching? Kalau buat randomization, kalau buat intervention study, ada tak randomization dibuat? Ada tak matching dibuat? That is all dekat method section. Yeah? Okay. Selalunya, bila kita conduct study, in the method section, they must at least one sentence about the reference population. Kemudian, siapa source population dia? Source population meaning from where you take your sample. Kemudian, ada inclusion exclusion criterianya. So whoever fulfill the inclusion and exclusion criteria will become the eligible population. So from the eligible population, katakan 10,000 eligible, tapi you perlu 2,000 saja. Of course, how did the study select the 2,000? There must be some sampling method. Ada mention tak? Because sampling method very important. A study with a good sampling method, katakan randomly, so you know the result, you can generalize to semua remaja Indonesia. Sebab sampelnya random, dia mewakili. Study sample, kalau nak buat intervention study, intervention maknanya sebahagian remaja Indonesia yang telah dipilih diberi a new mobile application about smoking. This is a new technique. Lagi satu grup tidak diberi apa-apa. Tapi bagaimana mereka pilih who will go to the mobile apps group, who will not go to mobile apps group. It needs to have a method, which is randomization. You will be surprised when you read a paper looking at intervention, but there's no randomization. Okay, so that's a poor paper. Yeah. Now, kenapa important for a paper to explain how they choose study subject? Are we okay? Kita sampai 2:45. 3:45 waktu Malaysia. Kan? So we still have like 1 hour lagi kan?
Yeah.
Okay, alright. Alright. Now, kenapa when you read a paper, when you appraise a paper, you have to look at how they choose a subject because we would like to avoid selection bias. So what is selection bias? Selection bias ni bila dia berlaku? It is when characteristic of the selected sample in the study differ from those who are not selected in the target population. So siapa yang kita study, karakternya lain daripada yang kita tak study. So whatever result we have from that study, whatever result that the paper have from that study, it will actually result in a sample that is unrepresentative of the population of interest. Ia bukan mewakili population of interest pun. So we need to avoid selection bias. So in a good paper, when we appraise, when we read a good paper, they will explain, they will tell you how they address selection bias. Selection bias ni, to understand this, you must understand what is selection bias. What can be considered as selection bias. Ada banyak selection bias ni. Saya tak akan go detail semua. Saya akan just touch sedikit saja untuk setiap jenis bias ni. Ya. Ini antaranya, ini tengok gambar ni. They have been selected into the study, but you can see the way they have been selected, they were selected randomly. Tapi which randoms, betul ke randomly? Yeah, because you can see kalau they selected randomly and they'll get like this, that's fine. Sebab sudah random, so whoever selected is by chance. Yeah. Now, what a selection bias that a study may have? Saya akan terang satu-satu. Misclassification, volunteer, survivor bias, non-respondent bias, loss to follow-up bias, and there are also bias specific to study design. Now, we go quickly. What is misclassification bias? Okay, this knowledge you need to know. So when you read the method, when the paper, the method section in a paper, when you read, you have to look at how they select their participant, their sample. Is there any selection bias? So what kind of selection bias? Okay. Number one, if you are reading a case control and cohort study, you may want to look whether they have misclassification bias or not. Misclassification bias ni maknanya the study misclassify the subjects or participant in relation to their exposure or disease. Maksudnya, in case control study, case control we start with case. Hello? Okay. In a case control study, yeah, we start with a case group, which people with disease, and we start with a control, people without disease. However, when there is misclassification bias, some subject with the disease, you classify, the paper classify as a control, and some without disease, they misclassify as cases. How this happen? I will explain it. For cohort study, we start with non-exposed, no respecter, with respecter, non-exposed and with exposure, and we follow, yeah, whether who developed disease. So in cohort study, they may misclassify those who have respecter with those who have without respecter. I will give an example. Okay, let's look at this. Ini cohort study, ya. Cohort study is prospective kan. We start sample of disease-free individual, and then you follow people, those with risk factor and those without risk factor. For example, those who are smoking and those without smoking, and you follow who developed disease. Now, what happened in cohort study? Misclassification bias can occur when you want to classify siapa yang exposed to risk factor, siapa yang tak exposed. Contohnya, let's say you are studying alcohol and liver cirrhosis. Yeah? association between alcoholic being an alcoholic with liver cirrhosis. So the exposure is being alcoholic, right? So when you want to categorize this disease-free individual into alcoholic and non-alcoholic, what is your definition? You have to have a clear operational definition. So if the study didn't have any clear operational definition, for example, if the patient stopped drinking alcohol last week, you're going to categorize it as non-drinker or as a drinker, because now the person has stopped, but only last week. So you have to have operational definition, a clear operational definition, so that you don't misclassify those into a wrong group. Yeah, because when you misclassify, when you misclassify, you will end up with not accurate result. Yeah, because you already have selection bias. Yeah, sebab katakan stop drinking alcohol ni baru last week you categorize it as non-drinker and you put it on in non-exposed group. But actually, this is considered as being exposed. So when many people who drink alcohol last week stop and you put it in non-exposed group, you will end up many of people here also develop disease because they are also alcoholic, just stopped last week. So the difference between people who develop disease here and here will be minimized. And then you end up saying, oh, okay, alcoholic actually does not cause liver cirrhosis. But that finding is not valid because you misclassify the exposure. Now, in case control, yeah, like you want to see, halitosis and no halitosis, yeah, mulut berbau, So halitosis sepatutnya disease, non-halitosis sepatutnya control, and you look at their past exposure. But how do you actually define halitosis? If you don't have unclear operational definition, you may actually categorize people with halitosis as control because diagnose macam mana? You must classify. This halitosis is diagnosed by halimeter, so standard, yeah, or by self-report. Yeah. That is misclassification bias. In selection bias, you could also have volunteer or referral bias. This is when you appraise a cross-sectional and clinical trial. More likely to happen in a cross-sectional study and clinical trial when the sample, those sample who volunteered to participate in the study are different than non-volunteer. Jadi bila you baca tu, you tengok. If they say, okay, the sample is actually volunteer sample. So in your mind, you already take note, okay, if the sample is voluntary, then you know what kind of bias is actually introduced in this study. So when you interpret the result, you know, okay, they have voluntary. So result has to be interpreted in caution, yeah, because when we have volunteers in cross-sectional or clinical trial especially, volunteers normally are the one who unwell kan. Kalau orang yang dia rasa dia ada sakit ni, they are more concerned about their health. Imagine if you are doing a clinical study, you are trying to test a new drug or a new treatment method, yeah, and you have volunteers coming for your study, and these volunteers, yeah, dia dimasukkan dalam grup yang treatment baru, yeah. Of course, result you akan favor treatment group. Of course, study itu resultnya treatment akan efektif because volunteers tend to be more motivated. Dia akan lagi semangat nak try, compliance very good. So result akan keluar, ya, ubat baru ni sangat bagus daripada yang lama. But actually, there is a bias in the study. If you able to detect that, then you will interpret the result with caution. Now, again, another selection bias, survivor bias. This always happen in cross-sectional case control study where only the survivor, because you buat cross-sectional or case control, you only catch the survivor. Yeah? Yang jadi sample tu is only the people who survive, yeah? That will be included in the study. Because whoever that have mild cases, for example, kalau flu kan, sama-sama, sekejap saja sudah baik. So, kalau dia sakit, when you conduct the study, those with flu is already cured. Yeah, so there will be not in your sample, yeah, or severe cases they already died from the disease, so the study might have missed that, yeah. what is the effect of survival of prevalent bias? It will increase or decrease or odd ratio. So effect itu macam jadi lebih kurang atau lebih banyak. Non-respondent bias, of course, I think when you conduct study, of course you will have non-respondent. So what is the, how much is the non-respond rate? This can introduce bias because those who did not respond in a study differ in important way from those who responded. Maksudnya kalau you conduct study nak compare certain habit, people who practice SOP, people who tak practice SOP, how many will get COVID? And banyak COVID example lah, because now there's the in thing now that we're very much, right? So people practice SOP, people tak practice SOP, how many will get COVID-19? But there are quite many yang did not respond to the study. So people not practicing SOP, 20%. People practicing SOP, also 30% not responding. You have to see whether the characteristic, the study must tell us, okay, how many respond rate, whether the non-respond in a group control and a group practice SOP tadi ada beza tak in the characteristic, because that will actually influence the result. For example, a study on the effect of smoking. Of course, responder differ in their smoking habit from non-responder, who are usually heavy smoker. Maksudnya, if you conduct a study, normally kalau yang heavy smoker tu dia tak respond. So of course your result will be diluted because the one who's smoking is not in your study. So a good study, they must report the non-respond rate or respond rate, what are the characteristics of the non-respondent, whether the characteristics differ from the respondent. It is very common in all type of study. If the non-respond similar in all group, then the effect may not be serious. How to prevent? Maximize the response rate. Now, loss to follow up, kalau buat prospective study, those who remain in the study may differ from those who drop out. Okay, for example, excuse me, if those who drop out in the exposed group maybe are more likely to develop disease, then the risk of contracting disease among the exposed will be underestimated. Sebab apa? Katakan ini yang with the risk factor, we want to see how many develop disease. Tetapi ramai yang drop out from that group yang ada risk factor tadi. And the drop out tu sebenarnya more likely to develop disease. Then of course you will get the result yang merendah, orang yang expose tidaklah banyak sangat yang develop disease. Which actually is not a valid finding. Okay. Yang ini I will skip. Kalau ada masa, I will go to it lah Ini semua selection bias. Now, how to reduce selection bias? You have to have, that's why a paper need to mention, explain a proper inclusion and exclusion criteria, a clear operation definition. So when you read a paper, you find all this. You try to find whether there is inclusion and exclusion criteria, whether there is a clear operation definition of variable, how they maximize the response rate, did they do follow-ups, did they do intention to treat analysis for randomized study? Did they do randomization and allocation concealment for RCT? Sometimes this bias cannot be avoided. So when it is not, you tahu kan dia cakap sini memang ada kena volunteer. So memang ada voluntary bias. Did they acknowledge it as limitation in their study? So if they acknowledge, then it's still a good study because they acknowledge, they tell you that's their limitation. Okay, next. Tadi sudah sampai sample size semua, and then how they choose the sample. Now, still when you read a paper, look for what are the variables and research tools. A good paper, they will tell you, okay, the outcome of the study is quality of life of patient with cancer. So the outcome is quality of life. So the dependent variable in the study is quality of life. There are papers, they did not even mention what is the outcome. They expect the reader to find themselves what is the outcome of the study, which is very confusing sometimes. And a good paper, they will also mention about their independent variable. So independent variable or the factors of interest are what? How the factors are being measured. Kalau quality of life, apa? What are the instruments they use to measure quality of life? A questionnaire. Okay. They mention it. We use quality of life questionnaire to measure quality of life. We use SEQUA. We use whatever quality of life questionnaire. We use OHIP. Yeah? We use ECOHIS to measure quality of life of children. And this ECOHIS is a validated instrument. Then it's a good paper because they mention what are the variables and what are the tools that they use, and the tool has been validated and calibrated. Sometimes a poor study, they just use their own questionnaire without being validated at all. Yeah. So how do you know that the instrument is valid to measure the outcome? Yeah. Now, you have to, when you read, you have to look whether the measurements are valid and reliable. Okay. A good paper, they will mention about methods of measurement. They will describe in detail. What will they describe? You will find that whether there is inter or intra-examiner reliability, if they use a questionnaire, whether the questionnaire has been subjected to content validity or not, yeah, whether expertise has looked into the question or not, whether it has been tested, whether there is any pilot study, what are the from bug alpha reading, what are the factor analysis reading, yeah. If they use instrument, let's say weighing scale, then that weighing scale, has it been calibrated? Yeah, mungkin sudah guna 10 tahun, never calibrated. Then how can you know that the result is valid? Yeah, okay, right. A feature of high quality study is that they discuss how validity and reliability were assessed. So when we read a Appraisal paper, you must find whether they explain about their instrument is a valid instrument. If they use people like us, we doctors, dentists, we examine patient. Let's say we want to diagnose a patient, but we go into the field. We want to diagnose patient with COVID-19 again, yeah. But any examiner, has we been standardized in how to do diagnosis, yeah? Or how to do to take the swab? Has we been standardized? Kalau sudah standardized, ada tak ditulis dalam paper tu? And then did they conduct inter-examiner reliability, maknanya antara saya dengan Aulia, dengan Gia, dengan Prof. Taufan, has we been calibrated, standardized, and ada bacaannya, okay, 0.9, antara kita semua itu bagus, reliable. Maknanya not much variation between us when we do the diagnosis or screening. Mesti ada mention dalam paper. Paper without this, bukan poor lah, but is subjected to query. So a good paper, you must report this. Ini adalah semua about instrument bias. Occurs when calibration lead to inaccurate measurement, ya. Or kalau yang diguna instrumen tu adalah manusia, then it's not this standardized, ya. Ni. In a paper, good study mesti ensure reliability of an instrument. Reliability ni apa? Reliability ni maksudnya the instrument is consistent. When you measure many times pun, memang actual body weight-nya 50 kg. When you use that instrument, okay, katakan instrument tu weighing scale, when you use a few times, they will get about a similar result. So it is consistent. Yeah? Tapi kalau first time measure 50 kg, second time measure, wow, 40, wow, sebenarnya kurus. Tapi bila third time measure, 60 kg. Tapi bezanya berapa hari saja. So, meaning that there's some problem with the instrument. The instrument is not reliable. When the instrument is not reliable, how can you trust the results, right? Okay, validity, you are using the correct instrument to measure the correct thing. Yeah? Kita gunakan instrument yang betul valid untuk measure outcome itu. Kalau ketinggian, mestilah guna instrumen yang sepatutnya, ya, yang sudah dicalibrate, yang valid untuk measure correctness of an instrument measuring the outcome. Okay. Now, sudah habis semua measurement, finally sampai data analysis, ya. In a good paper, ya, when you read, you must describe in method section what statistical analysis was employed, and we as a reader, we must have some knowledge lah. So with this objective, what correct statistical analysis to be performed. But sometimes, if you don't have that knowledge, also tak apa, but you need to find statistician in your group. You must have someone with good knowledge of statistics so that they can verify whether with this objective, to achieve this objective, which statistical analysis should be used. Because inappropriate statistical analysis can also produce misleading result and lead to a poor paper. Yeah? Ini satu lagi assumption. You know that all statistical tests they have assumption, yeah. But most papers sekarang reviewer and journal has become more strict. They will ask, recently ada paper, baru dapat good news. One of my paper has been accepted for publication, but this paper need 2 years to be accepted.
Biarin aja.
Hello? Boleh dengar ke? Okay ke? Are we okay? I hear voices.
Maaf dokter ma'am.
Ya, saya dengar suara. Are we okay?
Ya.
Boleh
Oke,
ya?
Dok. Boleh lanjut.
Boleh teruskan?
Ya, teruskan. Boleh.
Boleh ya? Alright, whether in the statistical method they describe about confounder, yeah? Now come to conduct of the study. When we appraise paper, the part at data collection. Okay. When we read data collection part in a paper, these are the things that need to come into our mind. Number 1, could there be any bias when they collect the data? Number 2, could there be any confounding? And number 3, any untoward events occur. Kita pergi, could there be any bias first, yeah? Now, when we collect data at data collection stage, also ada potential bias. So a good study, they will address all these bias. They will show that they have taken measures to address these bias during the conduct of the study. So what are the bias? Number 1, information bias. Information bias maksudnya is related to how your outcome of study was measured. Ya, macam mana outcome of study tu diukur, measure. If you would like to know whether smoking habit of a person, outcome in this paper is, ini adalah cross-sectional study where the objective is to determine prevalence of smoking habit among Indonesian adults. So the outcome is smoking habit among Indonesian adults. So how do they measure the outcome? Okay, they just give a questionnaire, a series of questions, ataupun mungkin ada interviewer yang pergi tanya, go to the participant and ask whether you smoke in last 30 days, whether you smoke, how many cigarettes you take, did you smoke after you wake up from sleep, a series of questions. So the way we abstract the information, the way we get the information actually may introduce information bias. The information bias ni bias that occur due to the manner in which kalau interview, how the interviewer asks question. Now, information bias ni could occur in 2 stages, dekat research procedure or in the research tool. It can originate from researcher themselves, instrument, or the way method of data collection. These are all information bias. I will explain briefly. If you need to understand this, only when we understand this, then when you read a paper, you will be able to identify. Oh, when you appraise, okay, this is actually recall bias. Oh, this is reporting bias, but they have addressed it. Okay. Oh, this is actually subjected to interviewer bias. But what did they do? When you understand ni, barulah kita boleh appraise dengan bagus kan? Now, recall bias. Recall bias ni maknanya kerana dia perlu mengingatkan apa yang sudah terjadi dahulu. Jadi, it will subject to bias. This normally happen in a case control study. Di mana outcome being measured tu require the subject to recall past event. Maksudnya apa yang kita nak tahu tu memerlukan subjek untuk mengingati perkara yang sudah lepas. We always know that people often remember positive event. Mereka tak akan ingat negative event. The cases yang ada disease may be more likely to recall or deny compared to control. Recall tu maksudnya kalau kita, for example, if this study, the paper that you are reading now, is actually the objective to see whether cleft lip and palate patient patient with cleft lip and palate, whether the mothers take any medication or not during pregnancy. Yeah. So you will have two groups. One group, patient with cleft lip and palate. The other group, normal patient. And you will ask the mother of this CLP patient and the mother of normal patient. You will ask, okay, during pregnancy dulu ibunya ada ambil ke apa ubat ini, ubat ini, ubat ini. What do you think? You think the mothers in the normal group will remember or will try to remember? It is of no interest to them, yeah? But the mothers of CLP patient, they would like to know why, what happened, why this happened to my child, yeah? So they will remember, yeah, whether they take drugs or not. Now, in other situation, kalau kita nak tengok patient with oral candidiasis, which is HIV symptom, if you ask them, yeah, whether they have practiced high risk habit or not, the cases may deny the first exposure to high risk habit. So this is what we call recall bias. Yeah. So in certain case control, in certain study design, yeah, look at the objective. When you read the paper, you have to identify whether there is a recall bias or not. Yeah? Reporting bias is where bila patient are aware of the exposure or treatment received and may influence their response. Let's say you are now reading a paper on intervention study, yeah? But there's nothing mentioned in the paper that they do a blinding. They don't mention at all, tak ada buat blinding. Blinding maknanya patient tidak tahu mereka ambil obat atau mereka ambil obat baru yang sedang diuji atau mereka ambil placebo, obat biasa. Yeah? Mereka tak tahu kalau blinding. Kalau blinding, there will be no reporting bias. Maknanya study itu good study. Dia sudah address reporting bias. But a study yang tidak buat blinding, so the patient mungkin tahu. The patient who know that they are taking the new drug, what do you think? Of course they report good effect because psychologically, saya ambil obat yang baru. Yeah. How do you feel, Mr. A? Yeah, I feel good. It's better now. I'm better now. Less pain. Because psychologically, it's a reporting bias. Those patients who knows themselves, dia sebenarnya ambil the old drug, they might be unhappy, yeah, and report memang sakit. So, sakit sangat, tak ada beza pun. So, and you will see this type of study, they will report that the new drug is sangat effective, yeah, very good compared to the old drug. Not reporting, not knowing that actually they have reporting bias in the study. Kita yang baca ni kena faham. Interviewer assessment bias maknanya assessment of a patient may be influenced by the interview knowledge of the patient status. Maknanya kalau yang interview know the patient having the disease or know that this patient is taking new medication, it may influence us as interviewer or researcher. Yeah? Maksudnya kalau kita researcher, and we know this group of patient is taking medication. So when you ask, when they say sama saja kesannya doktor, tiada kesan, you may want betul tak ada kesan, tak ada kesan sedikit pun. Dia kata tak ada, betul ke? Cuba you fikir. Because you are already biased. You want them to say, yeah, there are some effect. Yeah, that is interviewer bias. So how to prevent? In a study, a good study, they will report. They do blinding of the patient and blinding of the examiner or interviewer or researcher. Yes. Masih boleh terima lagi ya, sedikit lagi. Intervention bias pula. This is basically associated dengan research yang compare group, ya, compare group. These bias involve differences in how the treatment or intervention was carried out or how subject were exposed to the factor of interest. Contohnya contamination bias. Let's say, for example, okay, this happened when members in the control group receive the treatment or exposed to intervention. Maksudnya, this paper we are reading now, they are doing an RCT. Yeah, they are one arm is actually looking at a normal treatment or normal method or normal health promotion yang sudah ada. Okay. COVID, normal health education yang biasa saja. But this other group, we using a new method of health promotion. Ya, lebih disesuaikan dengan target group. So kalau adolescent yang macam ini, kalau adult yang macam ini, yang ini the other arm is sama saja semua. Ya, okay. So we want to test this treatment arm, yeah, where the advice is tailored to the patient. However, somehow the people in the control arm, mereka ada dengar radio, mereka juga tengok di TV. Oh, kalau adolescent macam ni. Kalau yang tua kena macam ni. So they actually inadvertently receive the treatment or the intervention as well. That is called contamination bias. So you just look, some people they mention about this. The limitation of the study is contamination bias, because at the same time government is also talking about it. So at least they mention, so we know that is their limitation, and when we read interpret the result, we interpret with caution. Compliance bias maknanya compliance of the patient differ antara control dengan treatment group. Ya, bila compliance-nya differ, katakan yang control group lebih compliance, of course dia akan minimize the difference in the outcome between two group. Timing bias ni maksudnya if the intervention provided, study to introduce an intervention. Ya, again smoking, senang smoking, ya, tetapi sangat lama interventionnya. Dia untuk adolescent, tapi sebab interventionnya sangat lama, ya, adolescent tu sudah besar, ya, dia sampai jadi dewasa, ya. So this maturation alone, the participant from being adolescent now become adult, itu saja boleh menyebabkan dia sudah berhenti merokok. Because adult now, dia sudah fikir rokok sangat mahal, habis duit dia, ya, and then not healthy, so they stop smoking. So stopping smoking not due to the intervention, but due to the timing. Yeah, this is timing bias. So when you read a paper also, you must look at the timing, understand natural history of disease. Yeah, kalau the study is conducted in a very short duration of time also, when you read, this study, we are looking at an intervention to prevent caries. Yeah, tapi resultnya, this intervention is not effective in preventing caries. Sebab those group with this intervention also masih lagi. Tetapi you must remember, berapa lama caries untuk terbentuk? Treatment ni sangat short. Sempat dia untuk terbentuk macam ni. So you have to understand natural history of disease. For intervention bias is where the case group, those who receive intervention also receive another intervention. Jadi effect dia akan jadi lebih. Okay. Now, could there be any confounding? So when you read a paper, also think about ada tak confounding factor. Confounding ni a special type of bias. Ya? Selalunya, kalau you are reading a paper that look into, association between exposure and the outcome, that is where you have to think about confounding. Katakan paper ni to determine whether A associate with B, whether A cause B, then you must think about confounding. When you read, look whether they explain about confounding or not. Confounding ni contohnya, katakan paper itu sedang objektifnya untuk tengok whether smoking cause periodontitis, whether smoking is associated with periodontitis. But you know, yeah, the main confounder is gender, yeah, because male smokes more than female, and most smokers are males compared to female. If the sample in the study consists of 90% male, yeah, and also gender also associated with periodontitis, yeah, and your result will show, smoking really cause periodontitis, but it is not because the actual association, but because you have more males in your study. So what should the study do? The study should actually stratify the result. For the male berapa, for the female macam mana, untuk understand the real association, whether there's a true association between smoking and periodontitis. Another example of confounding, if the study you are reading is looking into whether exercise cause high cholesterol. We know that less exercise, high cholesterol. At the same time, the main confounder is age, because we also know when the age increase, the cholesterol also increase. So if we conduct a study to see whether exercise associate with cholesterol, but the study forgot about this main confounder, which is age. Yeah? And in the sample, you look at the demographic at this study, the sample all actually are old people. And the result come out as exercise is not associated with cholesterol. Or, okay, sorry. The result, let's say the result is high exercise, more exercise, high cholesterol. But actually, it is not really due to exercise, more exercise, low cholesterol or high cholesterol, because actually it's because of the age. Your sample consists of old people. And nowadays, I think nowadays old people exercise more than young people could, because young people are very busy with work. They don't have time to exercise. So old people exercise more. Yeah. But no, old people exercise more. Jadi, you dapat result macam mana? You dapat result high exercise tapi kolesterol tinggi ke rendah? Tinggi ke rendah? Saya takut semua orang sudah tidur lambat. Lama. Exercise dengan kolesterol. We're almost finished. Exercise dengan kolesterol. Okay. Cuba, siapa mau cuba? Exercise association with cholesterol. Normally, kalau high exercise, less cholesterol. Ya.
Less.
Tapi ini age ya. Age, kalau lebih tua, lebih tinggi kolesterol. Jadi, you tengok. Faham. Okay. Apa? Nanti I come back to this ya. Ada masa sekarang saya uji balik. Saya nak habiskan ini dulu, takut tak sempat. He reduce bias. So in a paper when you read, it has somewhere mentioned about standardization. They standardize the operation manual of study. That's a good paper. They train and certify the examiner because they want to improve consistency of measurement technique. That's a good paper. They refine the instrument. When they talk about measurement, they say it has been calibrated. Or they use automatic instrument to reduce bias, to reduce error in measurement. And then the automatic instrument, they calibrate the instrument so accuracy can be increased. They repeat the measurement, so they repeat the measurement and they take average. That also actually the effort of the study to reduce bias. If they mention all this, you know that it's a good study because they're trying to handle all the possible bias. Okay. They have a clear operational definition. They conduct randomization in an RCT study. They do blinding. That is a good study. Now, if the study subjected to recall bias, the researcher took an effort. For example, give equal incentive to both groups so that both will try to remember the exposure. They actually do multiple methods of following up. Maknanya the telephone, the mail questionnaire, so the response rate will be maximized. If they mention this in the paper, it indicates of a high quality study. Now, finally, any untoward events occur, a good study they will mention about response rate. Kalau low response rate, they will try to analyze this response, non-response ni apa karakteristiknya, berbeza ke daripada those who respond. They will report high missing value, how they handle the missing value, did they exclude the missing from the analysis. At the analysis part, what you need to appraise, were the basic data adequately described? Because like I mentioned earlier, all studies should report the characteristic of sample. How many subjects, the demographic characteristics, socioeconomic status, because this is for you to know whether the finding could be applied to your patients, whether this finding is relevant for your patient, or whether this finding is relevant to make a new policy for your population. So that is from the characteristic of the sample. In the analysis, you have to it's important because you need to assess whether the extent to which the finding can be generalized. Okay. Now, again in the analysis, a good study, it should begin with simple analysis followed by complex analysis. Some study, they just report multivariate analysis, and then they report univariate analysis. Actually, a good study, they will report univariate analysis. Univariate ni maksudnya satu exposure, satu outcome. Okay. Gender dengan COVID-19. Okay. Umur dengan COVID-19. Itu univariate. Satu exposure, satu outcome. Later, then baru multivariate. Multivariate ni maknanya dia tengok sekaligus. At one time, they analyze whether gender, whether age, whether occupation, for example, whether ethnicity has any association with COVID-19. They do the analysis together. One factor effect on the outcome when you control other factor. That is complex analysis, but it will appear in sequence. Do the numbers add up? Any inconsistency, you'll be surprised. A good paper when you calculate, dia tidak add up pun. I always do this because I ada banyak critical appraisal session with my postgraduate subject. The more they do it, they become more better. In fact, sometimes I pun miss because bila dia baca result tu, when they calculate the odd ratio semua, then actually you realize that the researcher has misleading you with their result purposely. Only when you really calculate, then you understand, oh, actually the effect is not as high as this. When you minus this and this. But you have to have skill to do this. With time, you will develop the skill. Okay, what's the statistical significance assessed? You must remember, bila kita kata pasal significance of the finding, there are two significance. Number one, statistical significance. This is what you get from the p-value. But sometimes, if the paper show a non-significant result, p-value dia more than 0.05, you also have to look at the result. Because sometimes, it got non-significant because sample size tak cukup. Tapi when you look at the result, there is clinical significance different. Clinical significance different. So there are two significant that you would like to look at when you read a paper. Okay, interpretation. This is in discussion. When you read, what are the major findings? There are many findings. What are the major findings? What do the main findings mean? Is it of clinical importance? They may have significant result, but actually it is of no clinical importance. Katakan measuring BP. Dua group, students lelaki dengan student perempuan, male student and female student. You want to compare their BP when sitting for examinations. So when you compare, there is different and statistically significant difference where female student BP is significantly higher than male students BP, for example. So result come up significant. But when you look at the difference of the BP, it's just a difference of 5 points. 5 points. So that 5 points, yang ini 90, yang ini 95, for example, is it of clinical importance? No, even though it is significant statistically, but clinically it is not of clinical importance. It becomes statistically significant sebab sampelnya ramai. Okay, what else might influence the study outcome? Researcher acknowledge the study limitation or not? A good paper, they will acknowledge, they will be upfront with the study limitation. Important effects overlooked. How do the result compare with the previous study? Sometimes there are many studies has reported a significant finding, but this study come out with non-significant finding. Some people may feel that this study is wrong, but no, you have to look at the method, yeah? Even though the result differ, refute the previous finding. But if the method is correct, yeah, when you appraise it properly, it is a good study. That may be a new finding with a different environment, yeah? So what implication does the study have for your practice? Of course, when you appraise paper, this is important. There's no point of reading a study without looking at what implication, yeah? And can the result be generalized, yeah? Now, okay, what we have discussed for the past maybe 1.5 hours is only a simplified standard appraisal question, yeah? Sebenarnya, different research design has different specific appraisal question. For example, for RCT study, intervention study, they also have extra question to appraise. They ask whether allocation concealment ada buat ke tidak, randomization ada buat ke tidak, blinding ada buat ke tidak. Yeah, okay. Now, and actually, yang we discussed just now is just standard appraisal question. There are many critical appraisal tools to help you when you read a paper. Ada banyak tool tool untuk appraise paper. So tak payah risau. Yeah? There are a range of critical appraisal tools that can help you to ask the right question when appraising research. Salah satunya you can Google CAPS. Yeah? CAPS ni dia memang ada tool untuk review systematic review, review randomized control trial, review qualitative phase control cohort, ya. Ada Joanna Briggs, ya. Ada Cochrane risk of bias, ya. Ada banyak. You Google saja, ya. So what do you want to use? Because different study design have different tool or method. Yeah, so this is my last slide. Hopefully, yeah. Hopefully, yeah. By listening to the lecture just now, at least you now understand why is it important to do critical reading or critical appraisal of scientific article, because you would like to identify a good, a useful study and valid study, so that whatever we apply to our patient or we want to make a new policy, it is based on a good and high quality evidence, so that we won't harm our patient or our population. Yeah. Because there are many scientific evidence and there are also many studies conducted poorly. Yeah? Now, hopefully, by now, if not all, at least you have gained some of the, have understand, yeah, some of the standard appraisal question for each section of a study. At least you know, bila baca paper, dia ada section-sectionnya. So for each section tu apa soalan yang patut you tanyakan bila you baca. When you baca method, what question should be addressed to the method section, yeah? So hopefully by now you have some gain a more confident, yeah, to appraise paper. But always remember, appraising paper critically is a skill. Skill yang boleh di-develop. So kalau first time baca, tak boleh lagi, don't get frustrated. Just practice and practice and practice. Finally, you find it very enjoyable, I can tell you. Bila you baca, you rasa seronok sebab you dah faham. Yeah? Alright, I hope you enjoyed your lecture. Thank you very much.
Ya. Terima kasih banyak Dr. Marhas for your amazing presentation. Ya, sebelum masuk ke sesi tanya jawab ini, saya akan mencoba untuk merangkum materi hari ini, Dokter. Yang pertama adalah mengapa kita perlu membuat critical appraisal, itu karena tidak semua naskah penelitian yang sudah dipublikasikan memiliki kualitas naskah yang baik. Jadi kita ingin menemukan high quality scientific evidence, seperti itu. Kemudian yang kedua, ketika membuat critical appraisal, metodologi penelitian itu sangat penting untuk dianalisa. Seperti misalnya aim, purpose of the study, desain penelitian, jumlah sampel, dan lain-lain seperti itu. Kemudian yang ketiga, untuk sampel penelitian, kita perlu memikirkan mengenai bias. Di sini juga disampaikan mengenai confounding factors tadi ya dokter ya, yang kita tidak bisa jawab semua tadi. yang berhubungan dengan determinan dan outcome. Kita juga belajar di sini bagaimana cara untuk menghindari bias. Seperti misalnya dengan mencantumkan kriteria inklusi, eksklusi seperti itu, dan memperjelas definisi operasional. Kemudian yang terakhir, untuk critical appraisal sendiri, sebenarnya ada panduan yang kita bisa ikuti, yaitu berupa checklist standar dan juga ada tools untuk membantu membuat critical appraisal. Ya mungkin sekian rangkuman dari saya. Tampaknya tadi sudah banyak sekali yang ingin bertanya kepada Dr. Marhas.
Ya.
Dr. Gea mungkin bisa di-share screen ya tadi.
Mana?
Rangkuman pertanyaannya tadi sudah dirangkum oleh Dr. Gea.
Sudah tampak ya?
Iya,
Oke.
diperbesar mungkin dokter di slideshow.
Ya, sudah nampak.
Oke.
Yang tadi sudah bagus. Yang ini terlalu besar. Yang tadi ya. The previous one is good enough. Ya.
Oke. Ini dokter, bagaimana?
This is good enough. Right.
Oke. Ini ada pertanyaan dari Zafira, dokter. Good afternoon, Dr. Marhas. As you said before, that the skill of appraising a paper critically is the skill that we can master gradually. So, and as an undergraduate student who don't have much experiences of doing research, is there any tips and tricks to master that skills? Is it enough to just read as many papers as we can?
Yeah, this is from a student point of view. Pertama, dia tak ada shortcut lah, tak ada tips and tricks. But what I can tell you, I understood from Dr. Gia and Dr. Aulia that for year 3 student, you already have your research method class. Yeah, but of course, I understand it is at undergraduate level. So what you need to do, you need to read. You need to polish your research method knowledge. So read, because selalunya dekat undergraduate level ni, kita bagi sikit saja, very superficial. But if you want to be able to appraise paper critically, you need to polish your research method knowledge. However, as a start, I think you don't have to ask all the questions that I teach you just now. Yeah, that is actually, I explain the details critical appraisal. Yeah, for you at your level, you may want to ask the basic questions saja. Tak perlu terlampau detail. But as you go with time, baru you go into more detail. The basic question is, aim jelas ke tidak? Study design-nya betul ke tidak? Yeah, and then methodnya itu you tak perlulah semua bias tu you nak kena check. Yeah. You tengok yang penting saja. I can share a paper, how to critically appraise a paper. I think in 2017, I will give to Dr. Gia. Yeah. I think in that paper ada 7 soalan yang perlu ditanya, because in a paper you cannot explain too much, right? There's a limitation. So dia guide dengan 7 soalan yang penting. Maybe that is suitable at your level. But if you want to be able to appraise paper betul-betul bagus, then you slowly develop your skill. Okay. Other tip is you start dengan paper yang senang. Yeah? You start dengan paper yang senang dulu, which is cross-sectional study. Don't go to RCT study first, go to a survey, questionnaire study, cross-sectional, because cross-sectional lebih senang. So, ambil critical appraisal tool. Yeah, I mentioned in my last slide, there is critical appraisal tool. You can use that in a critical appraisal tool. Soalannya pun tidak terlalu banyak seperti apa yang I have explained. Yeah, in critical appraisal tool pun dia sudah summarize kan. It's quite easy to follow. So you do for cross-sectional, search for critical appraisal tool for cross-sectional study and you use. Nanti dia tanya, you tengok dekat section tu. Ada tak informationnya? But for you to understand more why this cannot be like this, why this is considered bias, that is you need to learn more. Ya, untuk dapat macam in-depth understanding, you belajar lagi. So as a start, you boleh guna tool. I hope that helps. And start with a simple design, study design dulu. I hope that helps Zafira. Okay.
Ya, oh berarti harus banyak membaca dan practice our skill ya dok ya?
Ya, you boleh gunakan tool tadi, appraisal
yang
tool. Nah, you kena start dengan design yang senang-senang dahulu. Kemudian baru you increase ya.
Sudah jelas ya untuk Zafira. Untuk pertanyaan yang kedua dari Michael Raharja, dokter. Good afternoon, Dr. Parasrinda. In your presentation, you stated that we have to make a hypothesis before doing the clinical trial. I would like to ask, what if in the end there is a mismatch between our hypothesis and the actual result? Do we need to change our study design and our research?
Yeah, it's a very good question from Michael. This is a critical thinking question, meaning that you are thinking critically. Good. Now, before, not all study need hypothesis. Yeah, you must understand that. For example, if the objective to determine prevalence of COVID-19 among Indonesian population, okay, that does not need hypothesis. Hypothesis ini hanya perlu when there is element of comparison in your objective, when there is element of association in your objective. If you want to see your research, you want to see whether A is better than B, whether C is associated with D. Yeah, when you have that, then whether E will lead to F, then barulah perlu hypothesis. Hanya study yang ada elemen comparison atau association perlukan hypothesis. Now, tadi you kata before doing clinical trial. Clinical trial selalunya you are doing an intervention, right? So you have A, which is a normal treatment. B is a new treatment. Jadi, apa outcome you apa? Katakan outcome senang ya, saya bagi contoh yang senang. Outcome pain level. Pain level. So A, ubat lama untuk control pain level. The B is a better medication to reduce pain level after operation. Yeah. So your hypothesis, of course, sebab ini ada element comparison kan. We want to compare the pain level after taking these two medication. First group taking A medication, second group taking new medication. You want to compare the pain level. So when there's element of comparing, you need hypothesis. So what is your hypothesis? So hypothesis you punya hypothesis, research hypothesis adalah obat B, the medication B is better in reducing pain level compared to the old medication A. That is your hypothesis. The hypothesis now, which is statistic punya hypothesis for you to conduct statistical test, the medication A, the new obat, is as equal with medication B is as equal effective as medication A. Or your hypothesis now could be there is no difference in the effect of reducing pain level between medication B and A. Maknanya ubat baru dan lama tak ada beza. Itu hypothesis now. Hypothesis alternative or research hypothesis is ubat baru B better than ubat A. So when you conduct study, suddenly your result tidak sama dengan hypothesis you. Because your hypothesis, your research hypothesis, B is better. But your result come out as there's no difference or A is better. You don't need to change your study design. Because your study design, doing intervention study is already correct. when you conduct a study, you cannot expect the result will support your hypothesis. The result may actually support the null hypothesis, where actually, when you think B is better than A, but the actual result B is not better than A. You don't have to change your study design, provided you are from the very beginning using the correct study design, correct methodology. Are we okay? Is it clear?
Yeah.
Okay, it's very clear. Thank you, Doctor.
Okay. All right. Next.
Next question. From Rifka Ananda, Doctor. About I have a question about designing scientific paper. Basically, when design scientific paper, we supposed to know an issue or problem first that we are going to raise in the paper. But oftentimes we come up with an idea first before we find the issue. In that condition, what should we do? And do we have to start over?
Often we have an idea first before we find the issue. When you say you find the idea first, what are you referring to? Idea first to? What do you mean by idea first?
Mungkin Rifka bisa menjelaskan lagi maksud pertanyaannya.
Ataupun Rifka boleh tulis lagi sambil kita jawab soalan nombor 4. Boleh?
Ya.
Rifka tulis di chat. When you say oftentimes you find an idea first before we find the issue. What do you mean by that? Idea first tu maksudnya apa? Idea tu bukan isunya. Bukankah isunya yang idea tu? Okay. Nanti you explain ya Rifka. We move to next one.
Oke, untuk pertanyaan selanjutnya dari Kak Ramadhani. I would like ask about the originality of the paper. For example, there has been research with title The Effect of a Compound on Variable X, but after we do literacy, we know that these compounds are highly contained, let me say, in particular plant, and we want to examine that this plant against the same variable X. In this case, we can say that based on the titles, the two papers are not the same but have similarity in its main content. Is it okay for us to do this research, or this is not recommended because it is included in plagiarism, Doctor? Thank you very much.
Gia, can you please explain to me?
Yeah.
Other research, there has been research conducting on the effect of a compound on variable X. Variable X is the outcome lah. But when they do literacy, we know that these
compounds are highly contained, let we say, in particular plant, and we want to examine this plant against the same variable X. Maybe mungkin variable sesuatu variabel gitu, Dokter. Variabel tertentu.
Okay, maksudnya sudah ada research look into the effect of a compound on variable X. But Yeka would like to study this compound contained in different plant. And you want to examine this plant against the same variable. In this case, we can say that based on the title, the two papers are not the same, but have similarity in its main content. Is it okay for us to do this research? Well, this is not recommended because it is included in plagiarism. Okay, you can have a same topic of research. You can conduct it. Let's say it has been conducted in many other parts of the world, but it has not been conducted in your area. So you can still repeat the research, do the research, because it is actually in your own environment. So maybe it works in other part of the world, but not in your environment. So it is not considered plagiarism. Unless you do the same study, the same place, the same sample, then it is considered plagiarism. But even a study, katakan you nak buat study ni, so you search and you got a paper. However, how you have to think, how is your study can add value to the existing research? For example, katakan population dalam yang you baca tu population A, okay, in this plant, yeah, the compound. But in your study, you extend it to another plant. Then that is not considered plagiarism. Yeah. or the same plant, but because that study, very small sample. So you extend it, you enlarge the sample size. That is also not considered plagiarism. You are trying to strengthen the result of that study. You're now doing more sample. Maybe with more sample, the result will be different. Yeah.
Mungkin yang dimaksud plagiarism itu yang seperti apa gitu, Dok?
Plagiarism ni kalau you write a paper, yeah, and then you cite from other study, tapi you ambil ayatnya exactly like that without we call it paraphrasing, yeah. Whenever you want to quote, you want to cite something, you have to paraphrase. Kalau you nak take that exactly, you have to put in quotation. Ini another thing where you have to learn lah how to do paraphrasing, yeah, so that it is not considered as plagiarism. Yeah.
Yeah.
That is plagiarism in writing. Tapi sekarang kita sudah ada software, Yika, which is parenting software that you can actually use to assess whether how many contents of your write-up similar with other write-up before this. Itu pun selalunya clarity yang akan check, ya, 30% and above is considered plagiarism. But still, when you look at whatever yang similar tu, kadang-kadang pun kena tengok juga sebab sometimes it is a common term. Even a common term, you cannot use other term, but anything will detect it as similar. So, still have to look at the content, whether yang similar tu a common term. Yeah? We okay?
Okay. Okay, untuk next
I hope I answered
question.
the question.
Yeah.
Yes.
Untuk pertanyaan selanjutnya dari Lukas Aldi, I would like to ask to you, Doctor, about choosing the right article for our research. Let's say that we find two similar articles that we are going to read as our reference. That's the number of people that have already cited. That article can be a consideration of choosing a proper paper for our research. Mungkin makin banyak yang mensitasi berarti makin bagus begitu ya, Dok?
Ya, itulah maksudnya, ya. Okay, it's a bit tricky. Kenapa dia boleh dijadikan panduan, but not necessarily paper yang banyak cited tu paper yang betul-betul bagus. You still have to look at the methodology. You know why? Because some people, they cited paper yang dia mungkin sudah lama paper tu, ya. Of course, paper yang sudah lama lebih ramai orang cite compared to paper yang baru. Betul tak? Similar article, maybe that one came out about 3 years, ya, lebih awal. Of course, citednya lebih ramai, ya. Jadi tak semestinya kalau ramai cited is a better article. Mungkin yang baru tu dia sudah baca yang lama, dia sudah improve, ya, tapi masih baru dia dipublish, ya. Itu satu. Nombor dua, one other reason that people cited a paper more because the authors, ya, semuanya orang yang bagus-bagus, ya. Memang sudah established, ya, established in that field. So more people will cite, ya. Jadi yang macam itu memanglah paper yang lebih cite tu lebih bagus. Jadi dia tidak ada standard jawapan lah. Maksudnya bergantung kenapa paper tu di-cited lebih ramai. If it is because of the author, the researcher is established, ya, memang ramai lah yang akan cited untuk researcher yang baru. Walaupun studinya bagus, tapi kadang-kadang kurang di-cited sebab belum terkenal. So kalau you tanya I won't use that as my main criteria. I will still look at the paper. But if you don't have time, you really impressed for time, so maybe you akan tengoklah science. Sebab at your age and stage, you wouldn't know, right? People that paper that been cited, is it because of the author is very good? You tak tahu lagi. Jadi you cannot use that. To me, I would advise you not to use that as your main criteria. You still have value to look at the value, the methodology of the paper. Okay. That's my personal opinion, because this is a very subjective, yeah. It's a preference of people. To me, that's my personal opinion lah.
Yeah. Oke, mungkin itu tadi jawaban dari Dr. Marhas untuk Lukas Aldi. Untuk pertanyaan yang selanjutnya, Dokter, dari Rizky Rahayu. I would like to ask to you, Doctor, if we do research and need a sample a sample, but the variable we are looking for is rare. Then we know two different kind of persons with the same condition who fit that variable, in which one of them having a lower corporation that rate that may cause a lost contact in the middle of the research. So we choose the other one. Thus, this kind of biasing is allowed.
Yeah. Yes. Okay. Two different kind of person with same condition who fit that variable, in which one of them having a lower corporation rate that may cause a lost contact in the middle of the research. So we choose. Okay, you can do this, but you must be transparent of how you select your sample. So you must tell in your method that you are choosing this, you are excluding. In your inclusion and exclusion criteria, in your exclusion criteria, you have to mention that you are excluding people with low cooperation rate. But how do you know they will have a low cooperation rate? Maybe you know it's very far away, they cannot come. So you have to mention in your exclusion criteria. If you mention that in your exclusion criteria, whoever that read your paper, they should understand whatever result that you have, it is actually to be generalized to certain group of patient, which not considering who you have exclude. Faham ya? Sebab ni sudah mention, yang ini sudah exclude. Jadi, you memang sudah terang-terang tulis you exclude this. So, the results tu memang should be interpreted with caution lah. Kalau you tak cakap, tapi you keluarkan dia, then it is not fair. Sebab dia memang introduce bias. But if you have mentioned it in your exclusion criteria, then it's fine. Okay?
Yeah.
But you must know when you interpret your result, you must know lah. Actually, if I include the other person, the result may be different. Because yang pasal drop out ni, kita ada method in analysis to tackle this. Sebab when we conduct cohort study, selalu ni drop out ni in a cohort study lah, in a prospective study kan. When you start with 1,000 people in the treatment arm and 1,000 people in the control arm, tapi studinya lama, ya, maybe katakan 5 years ataupun even 3 years. Ramai yang sudah drop out daripada treatment arm, even in a control arm. So, this may actually affect the result, but we have a method to control this. Maybe later when you do your postgraduate, you will learn about intention to treat analysis. So, if you include the person yang tadi tu lower cooperation rate, you can include them in. But then when you analyze, you have to use certain analysis to control this dropout, to consider this dropout. Okay, I hope ini boleh menjawab.
Iya. Mungkin ini ada 2 pertanyaan terakhir, Dok.
Tadi ada yang kita minta dia tolong terangkan apa idea tadi tu. Siapa tadi tu? Who's that? Tadi soalan yang ketiga saya rasa.
Iya.
The third question.
Tadi kayak
Gimana, Uber? Dr. Aulia gimana? Maaf.
ini kalau nggak salah punyanya siapa tadi ya? Yang
Dari
menjawab
Rifka,
pertanyaan.
ya?
Iya, Rifka
betul,
itu
yang ini.
dia.
Bukan.
Iya. Chat box, dokter. Kata Rifka, idea that I mean about innovation idea first, dokter. Before a problem. Jadi sepertinya dia punya sebuah ide terlebih dahulu, kemudian dia baru menemukan pokok masalahnya yang lain seperti itu, dokter.
Sudah ada idea buat research baru jumpa masalah.
Iya,
Betul kan
Iya.
begitu?
benar seperti itu ya, Rifka ya?
Rifka,
Sudah
ya?
ada idea, kemudian buat research, midway baru jumpa masalah. Betul tak? Begitu. When you want to do research, okay. When you want to do research, you must have a problem. You must have a research question. Apa soalannya? Apa soalannya itu? Soalannya itu selalunya soalan yang ingin diselesaikan. You want to answer that question by conducting the research. Yeah. So meaning that you have to know to identify what is the problem. Because from the problem you will ask the question. Yeah. From the research question you will have the objective. From the objective you conduct the study. Kalau you dapat idea saja, idea macam mana you nak start research before you know what is the issue that you want to settle? Yeah. Itu sebab if you write a thesis pun, the first chapter memang akan cakap pasal problem statement. So you must be able to identify the issue. Mesti ada issue research question yang clear, baru you boleh convert that research question into hypothesis atau mungkin tak perlu hypothesis, but a clear research question which is the issue. Then you can have a clear research objective. Barulah research yang you buat tu, you akan pilih study design yang betul untuk jawab objective you. You akan pilih method yang betul untuk address your issue. Ya. Kalau kita ada idea, okay, idea nak buat something about this. So you pun buat, kemudian baru jumpa masalah lain. Baru buat, tak boleh macam tu. Unless your idea tu, idea yang mula-mula tu memang sudah ada masalah dia. So your first idea is already you have a problem in the idea. So you start off with trying to settle your first idea which is a problem. And in the midway you find another problem. That's fine. That's fine. You can add another objective. Macam tu. Tapi you mula tu, your idea yang first tu mesti ada problemnya. In the midway if you find another problem, you only add another objective that suits the method of your research. Are we clear?
Ya.
Okay.
Sudah clear ya, Rifkah Ananda? Ini banyak pertanyaan, cuma hanya waktunya ini sudah habis. Mungkin satu pertanyaan terakhir dari...
Ada berapa soalan?
Gimana, Dokter?
Ada berapa soalan?
Ada 3. Dok. Dua lagi pertanyaan. Dari...
2 okey, I boleh entertain 2 soalan lagi tak
Gak
apa.
apa ya? Oke.
Tak apa.
Ini dari Dennis.
Okay,
Good afternoon,
Dennis.
Doctor. My name is Dennis. I have a question. If the measured variables with their statistical analysis are significant, but the discussion and conclusion are not convincing, can I still use the data and results of the study?
Results significant. Dennis, results significant. But the conclusion is not convincing.
But yeah.
Why is the conclusion is not convincing?
But the discussion and conclusion are not convincing.
When Dennis cakap, can I use the data of the study, maksudnya apa? Guna result itu. Does it referring to using the result, the finding? Okay, apa saya jawab macam ni. A poor study also can have a significant result. A good study also can have a significant result. A poor study also can have non-significant result. A good study also can have non-significant result. So result does not indicate whether it's a good study or not. Yeah, that is why you need to appraise the paper. Whether the objective is good, research question is clear, study design is appropriate to answer the objective. Yeah, the study may use wrong study design but get a significant result. Tapi sebenarnya salah. Yeah? So significant result doesn't indicate it's a good paper. You memang kena baca methods dia. Kalau methods dia, objektif, study design, method semua bagus, okay, yeah. And then result non-significant, you can use the result. Yeah? Or result significant, of course you can use the result. I hope that answered Danny's question.
Can use the data. Can still use the data, but tidak menandakan bahwa dia bagus atau tidak begitu ya.
Use the data meaning use the
result. Kan karena the result is significant, apakah masih bisa digunakan walaupun conclusion-nya itu tidak meyakinkan seperti itu. Tidak.
You will, okay. Ada banyak study, result tak signifikan.
Hasil resultnya itu apakah masih boleh digunakan seperti itu? Walaupun
itulah yang saya jawab tadi. Result ini boleh digunakan atau tidak depending on the quality of the study. Kalau studinya very poor quality, even the result is significant, you tahu it's from a poor quality study, so the result may not be valid even though it is significant. Ya? Ya? Maknanya bila kita nak, when we want to decide whether we can use the results or not, that is why we do critical appraisal, because we want to find a good quality study where the finding is useful and the finding is valid, so that we can use the finding to apply to patient policy for ourselves yeah. So the result needs to be valid first. For the result to be valid, dia mestilah study tu bagus kualitinya, baru resultnya valid. Resultnya kalau signifikan atau tak signifikan pun, dua-dua boleh guna. Asalkan studinya bagus, baru resultnya valid. Kalau resultnya signifikan, but when you read, it's a very poor study. Study designnya tidak betul, banyak yang tidak betul. So even though the result is significant, you cannot use, you better not to use it lah. It's strong to say cannot use it. You better not to use it because it is not a valid finding.
back to based on
maksudnya.
Tadi.
Sebab itu kita kena appraise critically supaya kita boleh faham result ni boleh guna ke tak boleh guna. Okay, katakan when you appraise a paper, you know it's a moderate to good quality of study. Ya, dia memang guna aimnya jelas, study designnya betul, methodnya mungkin ada sikit-sikit tapi dia address, dia cakap as limitation. So the quality is moderate to good quality, and then dia punya outcome significant result. Yes, you boleh guna. You boleh guna result tu sebab dia moderate to good quality. So you can still guna result, but result significant. Tetapi dia punya conclusion non-conclusive, kan? It's a moderate to good quality study, result significant, tapi when they conclude, it's not conclusive. Okay. You still can use the finding with some caution sebab sometimes kenapa mereka tak conclude, the finding is not conclusive. One of the reason, maybe there is a better study design to answer. For example, kalau tengok treatment effectiveness, kita boleh buat intervention study. Tetapi intervention study pun ada banyak jenis. Ada yang non-randomized intervention study, ada yang randomized intervention study. Kalau mereka buat non-randomized, quality yang lain semua ada, so it's a moderate to good quality study, result significant, tapi conclusionnya tidak konklusif, because maybe you will find in the discussion, untuk lebih konklusif, you need to do another level of study design untuk result yang lebih konklusif. But you still can use the result tadi with caution lah. Yeah? Kalau if you want to have, okay, because in any subject matter, of course there are many study has been conducted. Yeah? Primary study maknanya macam kita pergi buat data collection sendiri, analyze, and then we publish. That is a primary study. So if you have like 300 students, semua buat study on smoking, jadi ada 300 primary study on smoking. Ya, tetapi I think kalau okay, let me tell you, kalau masih belum belajar lagi, kita evidence ni ada ranking, ya, ada ranking. Study design ni semua ada rankingnya. Cross sectional lower evidence in the ranking. Jadi kemudian case control, cohort lagi bagus, ya, RCT lebih bagus. Tetapi yang lagi bagus adalah systematic review and meta analysis. So selalunya kadang-kadang when we conduct a primary study, we find conflicting finding or conflicting evidence. Study primary yang dibuat oleh Dennis tidak significant resultnya. And study yang dibuat oleh Rifka significant resultsnya. So it's very conflicting. Ada yang 10 kata significant, the other 20 kata non-significant. So which one do you want to take? This is where you need to find a systematic review and meta-analysis paper. Because systematic review and meta-analysis, they akan collect all the primary evidence, they will do the analysis, they will review all paper, and they will do analysis, and they will pull all the result from each paper, they will come up with one finding. Whether it is effective or it is not effective. So kalau you nak yang conclusive, you have to find a higher ranking evidence study paper, which is systematic review and meta-analysis. Harap saya jawab soalan Dennis.
Ya, mungkin
Dokter.
sudah sangat menjelaskan gitu tadi. Ya.
Okay.
Satu pertanyaan terakhir, ya dokter.
Boleh? Apa dia?
From Eng Chiling. Selamat petang dokter, I'm Eng, ya namanya. I'd like to ask, based from your teaching experiences, may I know the main concern from your view if the students critically appraise a paper correctly? How the lectures actually evaluate if the students make it correctly? How the lectures actually evaluate if the student make it correctly? Thank you.
I think that's different. Okay, so to me, of course, I evaluate student at different level. Yeah? Kalau undergraduate, I don't expect too much lah sebab you belum ada banyak experience. That is why I will just give a main question. So kurang-kurangnya, my student know that it needs a very clear objective. Yeah? And then what is the correct study design? Yeah? Yang method yang terlampau detail tu slowly, like I said. But for my postgraduate student, I will expect, of course, more. Even postgraduate pun, as a start, you also fumble in appraising a paper. But as I said, a good guide is just use the critical appraising tool. Senang. You ikut saja apa yang dia tanya and trying to find. But when you want to understand the justification of it, then you need to read more lah on research method. And of course, as undergraduate student, you have expertise in your department. Yeah, you ada Prof Safa ni, Dr. Aulia, Dr. Gia. Semua lah, I do not know others because you are in Department of Public Health. Yeah, normally public health bagus ni appraisal lah. Sebab saya pun public health juga. Jadi, you can ask help from your lecturers. Yeah, dan live it together with your lecturers. So, kalau, siapa namanya tadi? Tan.
I'm chilling. Yeah.
Tan Chilling. Okay, yeah. Kalau Tan Chilling, you find it difficult, it's normal. You are in year 3, right? It's very normal. I can imagine my student year 3 here too. But if some people they have interest in this. So ada juga student yang bagus sebab dia ada interest. Because research method ini, bila you belajar, you seronok. Because bila you baca paper, you boleh appreciate the paper. Bila you baca, you boleh tahu paper ni, oh this is sebenarnya bagus, you boleh guna. Yang ni sebenarnya need to be improved. Ya? Jadi, you can be good, but you must learn the research method. Okay, saya bagi tahu ya, some people, dia tak ada inclination in doing research, right? So, dia tak minat pun. But, I must tell you that the way forward now is research. There's no way that you can avoid this. So, it's better for everyone to equip yourself with certain basic knowledge of methodology. Because we are in a professional field. Yeah? Professional kan, kita akan jadi doktor, akan jadi dentist. So, and things berubah kan. You have a new intervention, you have new disease, yeah. So, things will keep changing. If you don't equip yourself from now, you don't have that mindset, yeah, untuk baca research paper, I'm sure you will be left behind. So, my advice, yeah, for all dear students, yeah, even though you are year 3, start from now slowly. Perkukuhkan your research method, read a simple paper. So, bila you keluar, you graduate, you become a very good professional. You boleh guna evidence yang baru. You tak ketinggalan, yeah? Right. I do not know whether I answered the question or not because he's asking about my experience kan.
Iya, thank you very much dokter. Terima kasih buat teman-teman yang sudah bertanya. Mungkin saya kembalikan lagi ke dokter Aulia ya.
Ya, terima kasih dokter Mar for your amazing presentation and
Sama.
discussion. Sangat seru ya ini diskusinya, sangat menarik dan teman-teman ini sepertinya juga tertarik ya untuk mempelajari lebih jauh lagi mengenai
Dr. Aulia,
metodologi penelitian. Ya,
Dr.
dokter.
Aulia, I must say, I'm impressed with your students punya question and the way that their interest. Betul, sangat bagus. Ya. At year 3, you are interested to ask all this. I must praise you all lah. Very good.
Tepuk tangan dulu dong buat kita semua. Tepuk tangan dari rumah ya.
Mungkin sebelum kita akhiri ini ya dokter, kita screen capture dulu ya.
Oh ya, macam mana?
Foto bersama dokter.
Boleh, tapi saya tak pandai buat
Iya. Saya akan bantu capture screen-nya. Mungkin dokter Gaya
ya.
Bisa bantu aba-aba ya dokter ya.
Oke.
Ya.
7 kali ya dokter ya.
7 kali.
7 kali. Iya, soalnya ada banyak mahasiswanya di sini.
Ya, kena senyum.
Iya, yang pertama ya.
1, 2, 3. Oke, next ya.
Bentar dokter ya.
Oh iya. Sudah, dokter? Yang selanjutnya ya?
Selanjutnya. Oke.
Kameranya nyala nih. 1, 2, 3. Oke. Yang ketiga ya. 1.
Oke, 1, 2, 3.
Oke, yang ke selanjutnya.
Bentar. Selanjutnya. Yang keempat ya. Ya, boleh dokter Gia dipandu.
Oke, yang selanjutnya 1, 2, 3. 2 terakhir.
Masih banyak ternyata ya.
Iya.
Yang kelima sekarang dokter Gia.
Oke, 1, 2, 3. Yang keenam.
Yang keenam.
Hmm.
Yang keenam ini tidak muncul semua videonya, gimana ini dokter? Yang keenam dan ketujuh hanya nama saja.
Oh, apa? 1. Oke.
1, 2, 3.
1, 2, 3. Oke, 1 terakhir.
Oke, yang terakhir.
1, 2, 3.
Ya, sudah selesai.
Semoga bermanfaat untuk terutama teman-teman yang undergraduate ya. Karena bentar lagi kan mau menyusun ini, apa namanya?
Proposal skripsi ya kalau nggak salah ya.
Skripsi. Untuk menggunakan tadi metodologi penelitian ya, masuk di metodologi penelitian. Jadi semoga kuliah pada siang hari ini dari Dr. Madas Linda jauh-jauh dari negeri Semoga bermanfaat untuk teman-teman semuanya. Terima kasih Dr. Madas Linda, terima kasih.
Terima kasih kembali.
Terima kasih Dr. Mar.
Terima kasih Prof.
Very nice presentation, very great lecture.
Alhamdulillah, harap
Insya Allah ketemu minggu depan.
Ya.
Insya Allah.
Ketemu lagi minggu depan Insya Allah sama Dr. Madas.
Ya, benar. Insya Allah minggu depan.
Insya Allah.
Okay. Alright. Terima
Kan,
kasih ya. Boleh leave ya.
Boleh, boleh.
Terima kasih banyak. Assalamualaikum. Selamat berehat semua.
Terima kasih.